Hello, and welcome to the Better Man Clinics, the podcast where we talk to actual experts to address the questions that men want answered, but are either too embarrassed to ask or simply do not know who to ask. Before we get started, I do want to caution that the conversations on this podcast are for informational purposes only. They don't represent a medical consultation, nor do they present medical advice to individuals. Rather, we hope that the podcast empowers men with the knowledge and confidence to address these issues with their healthcare providers. As with any medical or wellness issues, you should always consult with your healthcare provider before beginning any type of treatment or preventative intervention. With that being said, in today's episode, we discuss a topic that concerns men of all ages: hair loss and baldness. Hair loss in men is extremely common, affecting approximately 50% of men within their lifetimes. While most men are concerned about baldness, many don't realize that hair loss is not a foregone conclusion. They don't know the ways to potentially prevent and treat this condition. In order to tackle this very important subject, we are happy to welcome a true expert. Dr. Elena Kandel is a licensed and board-certified dermatologist who commonly treats men for hair loss. After studying biology at UCLA, she went on to graduate from medical school at UC Irvine and then completed her dermatology training at USC. She's since been practicing dermatology in Los Angeles for the last 17 years. And with that, I bring you the Better Man Clinics podcast. All right, hello and welcome to Better Man Clinics. With us today, we are delighted to have Dr. Elena Kandel, licensed and board certified dermatologist. And who better to help us solve the problem of hair loss and baldness? Dr. Kandel, welcome to the program.
Thank you. Thank you.
It's a pleasure having you here, and our audience really appreciates your insights and knowledge about this topic, which is very important to men because, as you know, baldness and hair loss affects up to 50% of men throughout their lifetime. And it's a problem that's near and dear to all of our hearts. So again, thank you for the insights. We're going to start off before we dive into the actual details of hair loss. I want to actually get an understanding of your patients. So men that come to see you with problems of hair loss, are they usually the typical middle-aged man who sees hair loss as part of aging? Or do you see a lot of 20 and 30-year-olds that face the same problem?
Yeah, it's interesting because obviously hair loss can start as early as teens, but it's not noticeable probably till the 20s, if anything. I actually do have a fair number of young men, early 20s, late teens, coming in noticing, and then once they go online and see that it can start that early, they usually panic and want to seek treatment before it gets to be that noticeable that people know that they're going bald. So I think I see young men as early as 20, and then probably into the 50s is stretching it, because by that point they already know what's going on, and either they're on treatment or they've kind of given up.
Got it. So it would be safe to say then, when men seeing a dermatologist or other healthcare professional for hair loss, they're really kind of in the early stages of hair loss.
Yes. And I think it's kind of true for many diseases, is the people who see the dermatologist are the one who care about their appearance and who will, try to catch it very early, even if there isn't a significant amount of hair loss yet.
Got it. Well, that's important to know because you really want to get ahead of this, right? Because I guess once the die is cast, it's a little too hard to go back in many ways.
Yes. It's much easier to start with almost a full head of hair and keep it that way than to grow back a whole head of hair.
Perfect. Well, that's an important insight right there. So we're going to dive into hair loss, and we're going to ask the question that, is often asked by many: why me? Both in terms of those men that already have hair loss or balding, or those that are at risk, right? So in terms of causes, if you do a Google search today, there's going to be inordinate number of pages that come up, from everything that makes a lot of sense to things that are just way out there in left field. And I'm sure our listeners would love to hear from an expert into what really can cause this and what doesn't. And that's also very important, as you can imagine, in terms of their understanding of prevention, right? Because some things you can't work around and others you can. One of the things that I've seen over and over again is genetic causes. Particularly, you hear if your mom's dad has hair loss, forget it. You can chalk it up. You're going to be bald. That's the end of the story.
Yeah.
Is that true, or to what extent?
Well, to a certain extent, to a full extent, we know that genetics plays a big role in it. To a lesser extent, is it as simple as your maternal grandfather is bald and you're going to be bald? So they've identified a couple of genes, probably more than a couple of genes that are associated with baldness, most of which center around testosterone and testosterone receptors and how sensitive your receptors are to testosterone, because bald men don't necessarily have high testosterone. It's a matter of how sensitive their scalp is to that testosterone and the byproducts. So basically the chances are, if your either grandfather is bald, you're more likely to be bald. I've read that if your father is bald, you're 5 times more likely to be bald than someone whose father is not. And
Really?
there are some of the major genes that have been found. One of this is this AR gene that we think is, again, involved in the testosterone receptor. I think that is on the X chromosome, which is in fact inherited from the mom's side. But as I said, they found now that there's so many confounding factors that it's not as easy to say. But we know genetics is probably the most important part. We just don't know how to predict that well.
Got it. So obviously genetics not something we have tremendous control over, but at least we know that it does play a role. So if nothing else, I guess if your family members do have a full head of hair, at least that's one positive in
Yes,
your direction.
that decreases your chances.
Now, let's take a step back because you mentioned a few times testosterone. Okay. And so for the men that are listening to us that are kind of, not medically oriented, testosterone, as we know, is kind of the male hormone, right? It's the hormone that gives men male qualities, whether it's a deeper voice or more hair or other things that can make men men. What's that relationship between that and hair loss? Like why testosterone? And the other thing that we see a lot is dehydrotestosterone, which
Yeah.
some men listening might know that well because of the prostate. How does that all connect? What is the relationship between those hormones and hair?
So we know that testosterone and probably more importantly, dihydrotestosterone, or DHT, we'll call it. We know that those promote hair loss in men. And DHT is basically the active metabolite of testosterone. And basically there's different types of receptors for these. One's in the prostate and one's in the scalp, although related, are a little bit different. So there's 2 different kind of enzymes that work on them. And on the scalp, it actually it affects the way the hair follicles mature, and it causes the hair follicles to become what we call it miniaturization. So essentially what's happening is each hair follicle is becoming thinner and thinner, so the space gets wider and wider, and it also shortens what we call the anagen, or the growth phase of the hair. So normally your hair has a growth phase, a rest phase, and then a death phase. So if the rest and death phase are longer and the growth phase is shorter, and the hair follicles are getting thinner and thinner, you can see how that eventually, spreads into very little hair and just space, so to speak.
Yeah.
Yeah.
Got it. And
And
so,
go
sorry,
ahead.
go ahead.
No, I said, so basically the hairs cover less scalp.
Got it. And all of this is really dehydrotestosterone really has a big
Yeah.
impact on
Yeah.
those
So it's
phases.
exactly. Yes. So there's an enzyme that converts it, and that's basically where a lot of the hair loss therapies are targeted towards these enzymes.
Certainly, and we're going to obviously we'll keep that in mind as we shift over to treatment. But another thing that you said that's important is that I thought that the one thing that bald men have going for them is they say they're really macho, right? Because their testosterone is so high. But I guess that's not necessarily the case. It's just how their hair follicles respond to that testosterone.
Exactly.
Got it. Good to know. So again, whereas we can't really control our testosterone to that extent, or nor do we want to, as you said, there are therapeutics that we'll talk about a little bit later that can manipulate that a little bit. So what about other medical problems? Healthy men obviously lose their hair just as unhealthy men, but I understand there's other medical conditions that might predispose men to hair loss. Is that mechanism the same as typical men's baldness, or is that a whole different mechanism?
Well, we don't know. So we don't know, are they comorbidities, meaning do they just go together, or is something that's causing diabetes and high blood pressure and heart disease the same thing that's causing the baldness? And so we do see in men who tend to be bald, they have higher rates of heart disease, especially if you have hair loss in the vertex of the scalp, which is back here, like the crown.
Hmm.
Overall, we see higher rates of high blood pressure, obesity, obviously, insulin resistance or diabetes, and probably you're knowledgeable about this, that there is an increased risk of prostate cancer.
Hmm.
And whether that is a significant fact, should we be screening bald men for these conditions because they have a higher rate, or is it just something that kind of goes together? I don't actually know how much higher risk of prostate cancer, but I imagine maybe those receptors are more sensitive to the testosterone as well, because they
Right.
do get more prostate enlargement, from what I understand.
Right. And so with the prostate, we can see the connection based on hormones because, for our listeners, the prostate's very sensitive to testosterone and dihydrotestosterone too. And so there's a definite connection. With other medical problems, though, like with diabetes or I understand thyroid disorders or even lupus, that hair loss connection, I guess, would be a different mechanism, I assume.
Yeah. So when you're talking about autoimmune conditions, like, if someone has low thyroid or high thyroid, Hashimoto's or Graves', or if someone has, type 1 diabetes or lupus, that hair loss is probably not what we call androgenic or male pattern baldness. That probably is more related to inflammation. And,
Hmm.
with the thyroid, we think it's something called telogen effluvium, which is just stress on the body. Sometimes if there's different stresses on the body, then it shuts down functions that aren't necessary. So hair and nails may stop growing in times of acute stress. If you have a big weight loss or a major surgery, you may notice, people will notice that their hair starts falling out after these stressful events, or they notice ridges in the nails where they stop growing during that time. But those usually, when those problems are, you know, attended to, those usually will resolve and the hair will come back in, a year or so.
Got it. So you're kind of saying that, this is the body's way of conserving resources. So if there's a big
Exactly,
hit to the
exactly.
body, it's going to focus on what's going to keep you alive, not necessarily things like hair and nails.
Yes,
And
which are,
that type of hair loss with regards to medical conditions, that's not a male oriented type problem. Women can lose their hair in that type
oh
of
yeah, yeah,
scenario
yeah.
too.
So that's what I'm saying. That one's not related to androgen. But what you mentioned earlier in terms of the heart disease and the prostate and the diabetes, those are linked with androgenic alopecia or male pattern baldness. And again, we don't know if it's cause and effect or just similar things that are causing the male pattern, meaning is there a testosterone factor that plays a role in, heart disease and diabetes
Mhm.
versus different mechanisms.
And to that same extent, I would assume then, because we don't have that direct correlation, that if somebody is a diabetic, correcting their diabetes or improving their diabetes is not necessarily going to affect their effect on hair loss because it's not that kind of linear relationship, right?
No, no, it's just something more for, study purposes and an interesting fact. Except in the prostate cancer, I mean, I don't know how useful that would be as a screening and, to what extent it would be helpful in following those people more closely for prostate cancer.
Right. Again, because of the more direct relationship and reliance on the hormone testosterone
Yes,
rather than the
exactly.
other problems.
Yeah.
Understood. Understood. And what about medicines? I mean, people are taking so much more medicines today than they had been before.
Oh yeah, and
Um,
again, many medicines you look up, one of the side effects would be hair loss. But
mhm.
again, that would be different. So those medications, unless you're taking a testosterone supplement, although I don't know if those actually work on the scalp as well, because I don't necessarily know if the bodybuilders lose hair. I've never actually had a complaint from the, the men who take testosterone supplements about hair loss.
Hmm.
Most of the medication hair loss usually would be something related to what we call the telogen effluvium, meaning it kind of arrests the hair from growing. Or,
Hmm.
more serious medications like chemotherapy for cancers, those actually just obviously arrest the hair growth and it falls out. But those are reversible once you figure out what the medication is and switch to a different or stop the medication, that hair will usually come back.
Got it. Got it. So, it looks like we came across all the topics we discussed so far, genetics, hormones, medical conditions, medications. Those are real causes for hair loss to varying extents. You have two buckets there, right? One is with genetics and hormones causing what we consider male pattern baldness in lay people to describe it. And the others are kind of contributing to a temporary hair loss due to your body taking a hit. Now, none of those really men have control over, right? I mean, the ones that are temporary, their hair will come back, and hopefully, once their conditions are under control, genetics and hormones, they don't really have that much control over. But now I want to actually switch over to what I like to call fact versus fiction,
Okay.
because again, when you go to Dr. Google, all kinds of things start popping up, and this relates more to things that people do have control over, and whether those lifestyle choices or activities, behaviors can affect the possibility for hair loss. So this is kind of that I think would be, it's good to know what can cause it that you don't have control over, but it's better to know what can cause things that you can prevent.
Prevented, yeah.
So the first thing I think you've already covered to some extent, which is stress, but you covered like stress on the body from the standpoint of short-term hair loss. Again, with that hit of conserving resources, that hair that can come back. What about for male pattern baldness? If you're just talking the typical healthy man, would the level of stress impact hair loss, aside from the stress making you pull your own hair out?
Yeah.
Would your body naturally lose hair just from if you have a more stressful life than somebody else does?
I think if you have a baseline higher stress, probably not. But the stress doesn't have to be a medical stressor. So, as you said, if there's a significant stress in your life that's causing you, excess stress, and I think that translates into less, you sleep less, you're eating poorly. So I think it's not just the fact that your brain is stressed. I feel that other things are going to contribute to that. You probably would get hair loss, but again, that would be reversible, unless the stress goes on indefinitely. But it wouldn't be probably the type that's sensitive to the testosterone and DHT.
And again, it also would be short-term and reversible in that sense.
Exactly. Once we usually figure out what's going on and we're able to manage it, and things obviously I tell people a lot of times when I do think it's stress related, it's sometimes good to do things that decrease the stress, whatever that may be for every person.
Sure, and which could help all around with their overall health and well-being as well, I'm
Hmm.
sure, which is great. Now, what about diet? It seems like everything from heart disease to cancer, any medical condition, is diet related. Oh,
He just
who's
wants to
this?
say hello. Now he's leaving.
He looks like he has no problem with
No,
hair loss at
we have
all.
the opposite problem. He must have very low DHT.
There you go. Well, listen, we've had done our first canine diagnosis here on Better Man
Yes.
Clinic, but
Yes, go
uh,
ahead. I didn't hear your last question.
not a problem, not a problem. So with it's always good to have special guests on the program for
Yes,
sure.
I'm like, we have a special surprise guest. He really likes the camera too.
And but I can he looks good. So with diet is huge now, right? In anything, I'm sure your patients, anything from heart disease to cancer to anything in between, there seems to have been an impact from diet. Um, I've seen online, and again, I don't know how credible that there's questions about whether a vegetarian diet, for instance, might impact hair loss because of the lack of protein. Certainly
Well,
malnutrition.
I'm guessing diet will impact hair loss, but it wouldn't be the androgenic hair loss.
Mhm.
So of course, we see people who go on crazy diets, or we see people who go vegetarian without really knowing that where they should be getting their protein from or taking supplements as needed. But again, that would be reversible, and we would definitely diagnose, they would have a deficiency, whether it's, B12 or biotin, and that would be addressed and fixed with eating those foods or taking the supplement, and the hair should come back. So yes, diet most definitely would affect it, but probably, if you went on a super high protein diet, it wouldn't help your male pattern baldness.
But on the flip side, if I notice my hair thinning and I decide I want to start the latest and the greatest vegetarian or vegan diet, is that something to keep in mind, that it might impact?
Oh, for sure. I mean, if you're going to start a new diet, you definitely need to research what things you won't be eating and where you can get those comparable vitamins, minerals, and things that you need in your diet, and amino acids, especially for hair. So, if you're going to do a restrictive diet, you would lose hair whether you have a tendency to male pattern baldness or not. So it would always be wise to thoroughly research if you need to take supplements and what kind of things you need if you're going to do this long term.
And this is an important point. People who go on diets, they hear something great, they attribute diet as just an effect on your weight, or your appearance in terms of your weight. But, your diet affects so many parts of your health. And this is kind of why that public service announcement is necessary. Like when you take on an intervention like that, you always have to talk to your healthcare provider to at least get an understanding, right? Whether that's your dermatologist or your primary care doctor or someone in between, to understand, hey, I'm taking this on. Is this going to impact what I really worry about? Like in this case, hair loss, for instance.
Yeah.
Because you may have untoward side effects that you weren't expecting. Now, another thing that we hear a lot about, a serious issue we hear about with cosmetics, is smoking. How much does that play a role?
Honestly, in everyday practice, I can't say that I've noticed it as a contributor. Obviously, smoking probably decreases the blood supply and the oxygen to the scalp, so I imagine that would have some impact. And it's obviously not good for many other reasons. But in terms of genetically altering, your predisposition or bringing out your male pattern baldness at a certain age, I don't think that's related to like when you started smoking.
Got it. Always good to try to stop smoking, but again, we can't fully point the finger here.
There's many other reasons why you shouldn't smoke, but I don't think it would change what genetically you're predisposed to.
Got it. So now we're going to go to the little bit of the left field version of fact versus fiction that I want to run by you. And again, maybe these are correct. They just sound a little bit interesting, and they sound interesting because a lot of this is things my mother used to tell me to do to not go bald when I was a kid. Right. So one thing was wearing hats, because I don't know, maybe it suffocates the hair follicles. Maybe it does.
Oh,
I want to hear from the expert.
No, I thought you were going to say the opposite, that wearing a hat would help because it protects your scalp from the sun.
Well, listen, I will take either argument but that's why I want to hear from the expert. I'm sure there are competing theories here about hats.
So I don't think I've heard of the wearing a hat causes the hair loss argument. I could possibly see if your scalp gets exposed to a lot of sun, and but no, I think actually the opposite. So there's certain baldness that can be treated with actual UV light treatment. There's an autoimmune type of alopecia that we treat that way. So in essence, if you do expose your scalp, I don't think it would cause hair loss, nor do I think that suffocating your hair follicles would cause the hair loss.
Yeah, the theory my mother had, and I can share this with you openly, is that the hat actually compresses the hair against your scalp, that it literally suffocates the hair follicles. And I bought into this fully, but in doing some research for this episode here, she wasn't alone. There's a lot on the internet. I mean,
really?
nothing from particularly credible sources, but there's a lot out there, like with that theory that you don't want to suffocate your hair follicles with that baseball hat. So
yeah,
I can wear my Dodgers hat, is what you're saying.
Yes, I think you're fine. Yes, and I think a lot of the treatments that are out there are focusing on like increasing blood supply and oxygen and all this stuff, but I don't think a hat would contribute enough that it's an issue.
Got it. So moving on from there to brushing your hair. So some say, we've got all kinds of theories now. So like some would say that if you brush your hair too aggressively, you're going to pull your hair out that way. So you have to kind of be very gentle with your hair when you brush it. What do we think
Well,
about that?
yeah, again, I think long term, you're probably not going to change the outcome. But I do advise people who are experiencing hair loss, to probably try not to wash your hair as frequently,
To
because
wash your hair.
to not wash your hair as
Uh-huh. Uh-huh.
frequently. So, I advise people to try not to wash their hair every day. Other than the US, most countries in the world do not wash their hair on a daily basis, and it doesn't really require it. You kind of need that oil to protect the scalp and the hair follicles and the cuticles, so to speak. So I always say you lose a certain amount of hair every day. It's normal, we all do. On the days that you wash your hair, you probably lose double.
Really?
So if you're
That's
doubling
interesting.
the amount of time you wash your hair, you probably are doubling the amount of hair loss, because obviously you are manipulating it and pulling it a little bit when you are washing your hair. It's probably worse for women who have longer hair because there's a lot more traction going on, but I think there's some truth with men as well.
So just to clarify, during the hair washing process, is it the fact that you're running your fingers through your hair and kind of pulling it, or is it just
Yeah, I think
actually
you're
the water?
No, I think it's just the massaging and the pulling, like you're saying. And those hairs probably were already in, what we call at that point like anagen or telogen phase, meaning they've stopped growing. So they were going to come out, but maybe they would have already been replaced with one hair that was growing that would be noticeable if you didn't pull this one out too short. You know what I mean? So it allows the hairs coming in to kind of naturally push those hairs out versus removing it sooner and making it look like you have less hair.
Got it. So, I mean, this obviously a lot of things go into this, but like, what is a recommended number of times you wash your hair per week? Not shower, because people can shower
Yeah,
without
I
washing
say
their hair,
you can
obviously.
shower, especially for men, that's not difficult. So shower, you don't need to wash your hair. I would say 2 to 3 times a week for hair is probably more than adequate. And
And it's
go ahead.
and it's okay to get your hair wet. It's just that you don't want to do that rubbing
Yeah,
and brushing
yeah.
type
And
of.
honestly, I mean, you don't even necessarily need to get it wet if you don't want to, because you can shower from the neck down, wash your face, and be fine.
Mhm.
And you can avoid washing it every day.
Got it. Well, that's helpful. So 2 to 3 times a week. That makes sense.
Yeah.
So then the argument about hard water in the shower, then that shouldn't have too much of an impact one way or the other. Okay,
No,
got it.
no,
So we don't need to put the expensive shower heads with the filters and all that kind of
no,
stuff. Okay,
no.
good. Well, that's good to know. That's save people some money unnecessarily,
Yeah.
right? So, we're talking about washing our hair. Does it matter what we use, like in terms of like some guys use hair product? Like gels, or I don't even know what they're called. Does that change anything in terms of the health of your hair?
No, no, probably not. I don't think it does. I tell people that I don't believe that it's any of the leave-in products that would cause the hair loss.
Got it. So they're
If you're doing things like perms or like the Brazilian blowouts where you're straightening the hair, those probably could damage the hair and cause more hair to fall out. I mean, again,
Mhm.
that hair would come back, in a
Right.
few months, but I think in the short term that the gels and things probably don't make a difference.
They don't impact negatively the health of the hair or anything like that. Just by having that product in your hair potentially.
No, no.
Excellent. Okay. So anything else from in terms of, and thank you, this fact versus fiction was great because it actually, helps to understand what you can and can't do physically,
Uh-huh.
right? Anything else from in terms of prevention side that you can think of that you would want to share with the audience in terms of what you would recommend to them in terms of, hey, you know what, my hair is thinning, anything to do in terms of my activities to prevent it?
I mean, we know, and again, we don't know if it's cause and effect, but we know obviously obesity, diabetes, high blood pressure, and heart disease are related. So obviously trying to minimize the chances for any of those, and some of those you do have control of, especially your weight, which obviously can lead to the high blood pressure and the diabetes. Maybe that will in some ways help prevent some of the hair shedding, to happen so young. But I think a big chunk of this sadly is hereditary, so we see some boys in their teens starting to, where the hair starts to, recede, as we call it, in the temple areas.
Mm-hmm. Yeah,
Yeah.
absolutely. And that point about that overall health is an important one. I see this, in patients in urology as well, where you have this constellation of medical problems, right? Whether it be obesity, being overweight, having diabetes, high blood pressure, cholesterol, which doctors often call the metabolic syndrome. They
Yes.
impact so many things. Like, again, from what I see every day, they impact people with kidney stones, even though you'd imagine what's the relationship. It's there. They can
Hmm.
impact the risk of heart disease. They can impact the risk of cancer. And certainly they can impact, to some extent, hair loss, at least peripherally. And so that's why it's when we think about health holistically, really battling things like weight gain appropriately, really keeping a healthy diet, really exercising and maintaining that overall health. It really has this spider web effect, that it really affects so many aspects of health and wellness, that it just
Yeah,
can't be understated.
that's true.
So now we've talked about prevention. We did everything we could, but we look in the mirror, and you know what? You're looking like me. You got a little thinning here going on, maybe in the front, maybe in the back, maybe both. And you think this is still salvageable. I can still make something of this. It's not too late. Where do we go from here? And I'd like to start with kind of like the simplest, most innocuous things, and kind of make our way through to,
True.
the
Yeah.
the more kind of aggressive treatment. So even if we're starting with the super simple things that you can get in the supermarket, like shampoos, right? Like I've heard that there's different types of shampoos. I even heard like Head and Shoulders can sometimes help with that. What's your thought about shampoos and preventing hair loss?
I mean, I kind of scoffed at it at first, but in doing a little research, you're right. So zinc, which one of the Head and Shoulders has zinc, not all of them, but you can just get the purethane zinc shampoos, or the DHS zinc shampoos, and they have shown in studies, like usually over a 6-month period, that they do increase the hair density.
Mhm.
When you compare it with minoxidil, it's probably less than half as effective. But
Mhm.
in somebody who doesn't want to use minoxidil or doesn't want to deal with using the minoxidil, that would be a good option because, as you said, you have to wash your hair anyway, and why not start getting improvement? And so the Head and Shoulders, the DHS zinc are over the counter. Another one, I think you mentioned or we're going to mention, is the ketoconazole or the Nizoral shampoo. So the
Mhm.
1% is over the counter, so you can buy it anywhere. And again, they've mostly done small trials, uncontrolled, and they've shown that it does increase hair density in men over a 6-month period.
Mhm.
And so those are two things that are, as you said, very easy to do. And if you're just starting to notice some hair thinning, and you're a young man thinking, I don't really want to get into this whole, treatment thing, just switch your shampoo, and maybe you'll buy yourself a couple years where it kind of slows it down enough that you don't need anything else.
Right, because I mean, I see this aside from minoxidil or Rogaine, which we'll talk about in a minute. This is
Hmm.
just something you're going to the supermarket. You got to pick out a shampoo. You
Yeah.
might as well pick one that might help. Now, do we have any idea as to the mechanism behind this? Like, why? I mean, Head and Shoulders, I know it helps my dandruff, but why would it help me get thicker hair?
Well, we're thinking maybe the zinc is some form of anti-inflammatory, and maybe the testosterone is a pro-inflammatory, because that's
Hmm.
why it could be associated with the heart disease and things like that. And we know ketoconazole is an anti-inflammatory, and I know that orally ketoconazole can cause things like we call gynecomastia, which is like when men get bigger breasts. So there may be something with the ketoconazole also having some kind of anti-testosterone properties. It's hard to say how much of it would get into the scalp from the shampoo, but I guess enough to show some improvement.
Right, right, and
Well, I
yeah,
actually
ketocon.
didn't yet. Yeah, and I didn't look into, which I should check to see if oral ketoconazole has been tried. Not that I would use it because it's an antifungal medication, but it would be an interesting thought to see if oral ketoconazole has been tried for male pattern baldness.
Yeah, because ketoconazole is, as I know, is a treatment for prostate cancer, for advanced prostate
Oh,
cancer.
I did not know that, but
Yeah,
yeah.
so
So
that I can see the connection there. With T and DHT, it kind of does peripherally, but the zinc, I had no idea, but that kind of makes sense to me for sure.
yeah.
Um, the one that, okay, so You had mentioned minoxidil. We might as well go to that because that's the one that you always hear about the commercials for.
Yeah.
Rogaine this, Rogaine that. There's different forms and whatnot. First question: is that over the counter or is that prescription?
That minoxidil is over the counter. So trade name was Rogaine. They still have Rogaine available. Minoxidil is the generic, same thing, half the cost. They make a 2% for women, but even for women, I recommend the 5% because it's obviously more effective. They've actually done the study. So 5% minoxidil, and that really does work. And we used to think it's just by increasing blood flow to the scalp because it's a vasodilator, so it brings better blood supply, more oxygen, hair can grow better. But they've actually shown that it also increases the length of the growth phase of hair follicles.
Okay.
And whether that's by improving the oxygen and blood supply or a different mechanism, we don't know. But we know minoxidil does improve, the longevity of hair.
Got it. And so minoxidil 2% or 5%, is that a cream? Is that a gel? How does that come in?
There's a couple of versions. It comes as a liquid,
Mm-hmm.
which if you're a bald man, pretty easy to put on. It comes as a foam, which I kind of prefer, especially if you do have hair, because I feel it's easier to kind of get it into the scalp as a foam versus the liquid, which can be a little messy.
Mm-hmm.
So
And sorry, go ahead.
no, that's it.
Do you put this in, like, I have no experience with this, so bear with me, as I'm sure a lot of listeners don't. Do you put this in like a shampoo and wash it out? Do you put this in like dry hair and it looks like a gel, basically, that you're like a
Well,
product or something?
no, sadly, you just put it in and hope that it doesn't mess up your hairstyle too much. And as I said, if you're a fairly balding man, you have little to worry about. But if you have a lot of hair, it probably will affect like the texture. I don't think it behaves as a gel necessarily to make it stiff, but it probably does have some look to it. The biggest complaint I get is that it not that infrequently can cause some scalp irritation, and people complain about their scalp being itchy and red and things like that, but not too often, but it happens sometimes.
And is it something that they can just get at the supermarket as well? It's sold like with the shampoos and stuff?
Yeah, I don't believe it's with the shampoos, but you definitely can find it. I've seen it at Target, Walmart. So most of the major drugstores, and of course Amazon is always a good bet.
Is there, so again, with shampoos like Head and Shoulders, as a physician, I'm like, go crazy.
Mhm.
With minoxidil, with Rogaine, is there any contraindication? And by that I mean, are there any type of any men with any conditions, anything you can think of that where we should not recommend Rogaine or minoxidil to them without talking to their doctor, for instance?
I mean, the only concern would have been if they have contact with a pregnant female, but we found that it's applied topically. If you wash your hands after, there's probably little that would be absorbed and affect or could be passed on in using it topically.
Got it. And what kind of issues were they concerned about in terms of pregnant women passing on to
Like
the
could
fetus?
could it cause birth defects and things like that? But again, I don't think it's ever been documented to be an issue.
Okay, I mean, they can be safe with it. They can be, cautious with it. But what about for their own health? Any concern? You had mentioned the scalp irritation, which something to look out for sure.
Yeah,
But anything else
exactly.
that we should be concerned about? Because again, I always hyper vigilant when things are not purely over the counter, but they're still over the counter,
Yes.
where you don't know the person who's taking it, right? And you're not prescribing it. So basically, it's fairly safe medication for people to
Oh
take.
yeah. The minoxidil, I don't think you would experience any systemic side effects or the side effects that could come from taking an oral medication, because you're applying it on the scalp. It's a pretty thick skinned, part of the body, so you're probably getting very little systemic absorption.
Got it. Got it. That makes sense. Moving on to a couple of supplements. You had mentioned supplements a couple of times before. I'm going to throw a few out there, and I'd also obviously love to hear your thoughts on anything that you recommend to your patients. One thing that comes up a lot, both by itself and also that I see as ingredients in shampoos, is biotin. Like it brings, supposedly the building blocks of the hair, and it really
Yes.
it strengthens it. What's the deal with that?
I mean, unless you have a biotin deficiency, it's a B vitamin, so it's obviously pretty easy to get. There's no reason that you would need or we feel the biotin should help.
Okay.
So yeah, no, I mean, again, I know it's sold in a lot of formulas, and again, I do recommend it in women who have, their hair doesn't grow fast enough, and maybe adding a little bit, but I don't think in androgenic alopecia, I typically recommend it.
So for men, kind of a waste to be adding to, like, if you're going out to Costco to buy a big bottle of biotin supplements, probably not going to do you much good.
Yeah, I mean, I always say it's harmless because it's water soluble, so any extra, you'll just get rid of. So I don't worry about any biotin toxicity. But if you're thinking just from a money standpoint, there's no reason to spend your money on that.
Got it. And this, as a urologist, this near and dear to my heart. I saw it come up on the list on the internet was saw palmetto. And for those guys that don't know, saw palmetto is probably the most common supplement used by men for enlarged prostate. Has a modest effect, but it helps a lot of men. I'm assuming that the at least the idea here is the same as the idea with the prostate,
Yeah.
hormonal, testosterone, dihydrotestosterone, that whole pathway. But does it work for hair loss?
I mean, it's believed that, like you said, it inhibits that 5-alpha reductase enzyme that converts the testosterone to the active form. And again, there probably haven't been controlled studies, but it does show that both topically and orally, that it can be useful. I would
Mhm.
probably not do it alone. I would probably, if you're to that point and you're actively trying to treat, I would probably do, and you're thinking I'm staying over the counter, I would probably do topical minoxidil with maybe one of the shampoos and then add oral saw palmetto.
Got it. Oh, so that's an interesting point. So minoxidil, it makes sense to actually combine it with the shampoo. It's not an either
Oh,
or.
yes, yes. And again, I think I always tell people as with many conditions that we treat, sometimes 2, 3 ingredient combinations work much better than just the one thing alone, or the one thing alone may not give you the best results, but if you combine all three things, you would see even better because they're slightly different mechanisms kind of all coming together. So I think that list that you have for over-the-counter stuff, as I said, the minoxidil, if you're serious about keeping your hair, and I tell men, if you don't want to go the oral prescription route, I think the minoxidil should be for sure. And then the shampoos is probably a no-brainer because who cares if you're going to wash your hair, you might as well use a shampoo that may help, even if we don't know for sure, why not? And then
Exactly.
again, the saw palmetto is over the counter and you can buy the supplement, and I would take that orally.
Got it. So it's nice, and it's nice that they don't really interact with each other in a bad way,
No,
which is
no.
good.
And you can have a whole routine, which is nice.
And so the last supplement or supplements that I came across was something that actually I see on commercials all the time now. It's called
Yes.
Nutrafol, where I went on the website and I took a quick peek, and it seems like it's just a combination of supplements. I don't know if there's anything proprietary there.
Well, no,
Um,
it's proprietary because I couldn't really figure out exactly like what is in their proprietary formula.
Got it. Because I saw
And
things like I thought I saw things like Bite and other things, but maybe there's stuff on top of it.
yeah, and again, most of the studies that kind of looked at it are obviously paid for by them. And I would say, again, it's probably one of those things that's harmless, but I wouldn't do alone. If you're already investing money in treating your hair loss, I would take this as an adjunct to one of the other things we discussed.
Right. Not enough on in and of its own potentially to
No,
really
no,
do that.
not to spend your money alone.
And so, okay, before I even move on, anything else from a supplement standpoint that you might recommend that we didn't cover?
No, I think we covered the supplements pretty well because everything else is going to be prescription and actual like interventional stuff.
So with these supplements, I'm assuming that this is really going to mostly impact people with just starting that journey, right? That
Yeah.
they're starting to see some thinning hair. This is not for people who have full-blown hair loss and male pattern baldness.
Yeah, especially when you're looking at the topical thing. So minoxidil, and I do think it increases the hair density, but their big studies were geared towards showing preventing hair loss.
Hmm.
So in their original when they originally came out, they mostly discussed like, we're going to prevent you from losing your hair. There was never a guarantee that you're going to get all your hair back. In essence, I think the increase in the hair thickness and the density does give it a fuller look. But if your hairs are, down below your ears and everything between is gone, there's probably less chance that you're going to look like you've grown back all your hair.
Because is it growing back at that point? If you have a guy that's really has hair loss and bald, I mean, is it just basically growing back peach fuzz at that point rather than real
Yeah,
hair?
that's the problem too. The older, unfortunately, many things, the older you are and the more extensive the hair loss, the less chance it is that you're going to get hair back. So, if I have a 25-year-old guy with some thinning, in the crown, there's a good chance we're going to preserve that hair and maybe get it a little fuller up there to cover more of the scalp.
Mm-hmm. Got it. And so let's diverge now from the over-the-counter medicines to prescription. So this is a medicine, at least one that I know of, that you really do need to see a physician for,
Yeah.
right? You can't just go online and on Amazon and order it. So the one that I know of, finasteride, or I guess the trade name from the urology standpoint is Proscar. I think in the hair loss arena, it's Propecia. Tell us a little bit about that, and kind of who is the man that you prescribe that for, as opposed to all of these supplements that we talked to, or maybe it's both.
Yeah, so finasteride or Propecia is essentially, well, the Propecia is a 1 milligram tablet. I think the prostate one, they use a 5 milligram, which can have much, much higher rates of other side effects, which we'll probably discuss in a minute. But it inhibits, again, that enzyme that converts the testosterone to DHT, or the active form.
Mm-hmm.
And the studies are very good. I mean, we have long-term data, and studies show basically in 3 to 4 years, you can increase the hair by 25%,
It's pretty
which
good.
is not terrible. No. So that's the upside. The downside, and I tell people, is once you've committed to taking this medication, it's a lifelong medication, or until you're old enough to decide, what, I'm happy to be bald now, because essentially once you stop, the hair fall will accelerate and kind of come to where it would have been had you not started at that age.
It just bounces
So
back quickly to that
yeah,
extent.
yeah. I mean, probably within a couple of years. I'm guessing it's not overnight, but it would accelerate and probably meet to where it would be, if you were 55 or 60 or however old when you started taking it.
Got it. And again, do you, as when patients come to you, do you reserve the finasteride for men with more significant hair loss, or is it
No,
just
no.
across the board?
It's across the board. So I usually will have the discussion, in terms of over-the-counter treatments and prescription treatments. So obviously the finasteride, most insurance companies, or many, won't cover for hair loss. So if
Okay.
cost is an issue, it's going to be more costly than some of the over-the-counter things. And again, this is, not something that you take for a month. It's going to be for many years. So, if you're going to start it and not be able to afford it in 6 months, it's probably not worthwhile to just even get into that. So I always discuss that. And, but again, if it's a young man who's serious about his hair and really has no desire to go bald and he'll do anything, this would be probably the best thing you can give him.
So on the flip side of that, so take that young male. So again, when we use finasteride, the 5 milligram dose
Yeah.
for men with enlarged prostates, there's certain side effects that that we're concerned, particularly with young men. Well, one of them being some sexual dysfunction, erectile dysfunction issues. What you had mentioned was gynecomastia, or breast enlargement in men, among others. There's also a theoretical risk of prostate cancer, although that's much more theoretical than anything else.
Yeah.
But are these side effects, particularly again when we're talking about young men here, right? These risks of sexual dysfunction, breast enlargement, do you see that same risk with that 1 milligram Propecia dose, or is it much less significant?
So I always discuss these risks. So I tell them, obviously, erectile dysfunction, decreased libido, decreased sperm count. There's always a list of these potential side effects. But as you said, with younger men, there's a much bigger reserve. So I don't find that they experience many of these side effects because they're probably not at the border in terms of if you take a 50-year-old man, he would be much more likely to experience these symptoms with or without the medication. And at the 1 milligram dose, I almost have never seen any of the sexual side effects.
Got it. Is there any concern? And again, it's interesting because even though I speak from the urological perspective, you see the younger men that are taking this
Yeah.
medication. Is there any concern of men who are trying to conceive, or are in the process of trying to have baby? Are there any concerns there from a fertility perspective?
Well, again,
Or
like we said, it decreases the sperm count, number one. Number two, we know that it probably can cause birth defects. So I usually say to be safe, we don't know how much of it crosses into the sperm and would be a concern. But I always tell them if you're trying to conceive, I would probably hold off on taking this. Once you're with your pregnant spouse or partner, I don't think it has any effect on you taking it. They used to say pregnant women shouldn't touch the pills, but I don't think that there's a lot of truth in that. But I definitely wouldn't plan on taking it while you're trying to conceive.
right. So for those men that are still planning to have a family, and especially in the near term, definitely not a great option for them to start off with versus, again, some of the
Yeah.
simpler things that we mentioned earlier. And it goes without saying that for something like this, not that that men would be able to get this over the counter anyway. It goes without saying that this is a medication that you definitely need to consult with your doctor
Yeah.
before even considering, as opposed to the other over the counter medications that we talked about. Are there any, I mean, I don't know, but are there any other prescription medications that you kind of pull out of your bag of tricks for men with hair loss?
Yeah, so I haven't really used as much as men, but in women, I've started actually using dutasteride,
Hmm.
which is actually, I think, 2 or 3 times more potent inhibitor of the 5-alpha reductase.
Hmm. Hmm.
And in women, I've seen actually better results than I do with the finasteride, which again, I use. See, in women, I use the 5 milligrams because we don't have any issues with the sexual side effects. So we're
Hmm.
able to use the higher doses with the alopecia. But I found that with the dutasteride, I use like 0.5 milligrams and I'm seeing very good results. So I probably will be planning to try this in men. Again, the limiting factor would be the sexual side effects if it's a more potent, 5-alpha reductase inhibitor. And I think it inhibits 1 and 2, so um, both types of receptors. So I don't know if that would be a bigger issue too in men.
Hmm.
But in women, the studies are very good with the dutasteride and the female pattern alopecia. So I'm going to try and see if I can use some of that.
Have they tested it in men? I mean, don't get me wrong, they've tested it in men for the prostate. Obviously, I prescribe it, but
In
do
hair,
you?
no. In hair, I
Okay,
haven't
got it.
seen any. Yeah, I'm sure there's probably some smaller studies, but in women, I found some studies, and yeah,
Got it. So kind of be a little bit more off-label in men for Scott. But again, they could certainly talk to their doctor or dermatologist about it to get their
yeah,
impression.
yeah, for sure.
Any other medications or?
No, unfortunately, in men, like in females, we use a medication called spironolactone, but in men, it actually does cause, breast growth and more feminizing features. So we're kind of limited in men because a lot of things that the testosterone controls are also basically we can't really diminish in men. So the sexual side effects and the hair on the body and things like that that men may not want to give up, and most men don't want to grow breasts. So it kind of limits the things we can use, where in women we can put them on a high dose of spironolactone and finasteride and it would be fine.
Got it. In
So in
men, that
men, we're
might be
limited, yeah, because we're combating the testosterone, but really you can't fight all you need the testosterone
right.
because men use a lot more of it than women.
Too big of a price to pay
Yes, I
for
think
hair
I
loss.
think most men would say they'd rather be bald.
I would imagine. I would listen to each his own, but I would
Yes,
imagine that's the case.
yeah,
Um, okay, so now we're getting to the heavy hitters, right? We've gone through the over the counters, we've gone through the medications. Now it's time to get really intervene, and this is something I have no knowledge of, but I'm sure you do. We hear about commercials, in terms of hair transplant surgery, hair plugs. Can you tell us a little bit about what's involved with that? What is that all about? How does that even work?
Well, so hair transplant, much like as it sounds, they essentially will go in and they harvest hair follicle units. So we used to do in the 15, 20 years ago, they used to go back and then like the back of the scalp, they used to take a long wedge and then cut it into pieces and then put them in. But now they actually do something a little more elegant and much easier for healing is they take what we call like a punch graft. So it looks like a little cookie cutter, 4 or 5 millimeters, and they go and they make a bunch of holes. So the thing that's required is that you haven't lost the hair on the back of the scalp. And
Hmm.
so a lot of male pattern alopecia happens in this area and stops kind of after here. So these hairs are not miniaturized. And so the theory is if you transplant those hairs to the areas of alopecia, that they will take on the characteristics of the back of the scalp instead of becoming miniaturized. And they've actually done studies and shown that it is indeed true. Those hairs, if they take and grow, they will be safe, and they will not be sensitive to that testosterone and DHT stuff.
And so, stupid question: what happens to the place where you remove the follicles from the
Well,
in
again,
the
you
back of the
basically you
scalp?
take this little punch graft. So if you think of 3, 4 millimeters, it's yay big, and then you put a stitch in. So you bring together the two pieces
Oh,
that you took out, and that's it. It'll be covered by hair. If you shave their head in the future, you'd probably see little tiny line scars where those punch grafts were done, but they would be, few millimeters across, and no one would ever see them. So it's a lot of work. So each session they may do anywhere from like 800 to 1200 of these
wow.
little, yeah. So, it's a lot of work, very expensive. And then you look like a mess for quite a while because they basically stick them in like you're planting roses. I don't even believe they anchor them. I think they just kind of put something over them and give them like a week or two to just take, so to speak. So you have to be very careful. I think you can't wash your hair for several weeks. So it's a big ordeal, but they're doing them very nicely now. So much more natural hairline. You don't have that like straight across where it looks like you remember the
Yeah.
old days with the actual plugs. So the hair, in a few months, you probably would have a hard time differentiating, natural from hair transplant. So it's expensive. I'm guessing it could run probably a couple thousand each session, and that one session doesn't begin to cover it. If you had one tiny area, but if you've got a whole hair to cover, you're looking at probably many sessions of this.
And so this is like a several months long type of journey. It's not like, hey, I'm just going to come in and get my hair transplant
No,
done,
no, and
basically.
not all of them take. So as you know, if you're a person who does a lot of planting, you know how many of your plants don't take. You probably get 20%, up to 20% that fail, and then you have to do those again at some point. So I'm sure not all 100% of the transplants will take.
And so you had mentioned, as opposed to the original hair plugs, what is the hair plug versus this, or
Well,
is it the
so
same?
the way the hair grows, it's basically you have these hair follicle units. So there's probably like 3 or 4 hairs that grow out of like a few follicles. So when you do this punch, you kind of look and see, and you get like a little collection of hair follicle units.
Hmm.
Whereas when they would take this large sheet before and then just slice it like you would, a brownie into
Oh,
quarters. So they weren't really differentiating these hair follicle units. They were just making little squares
I
and then
see.
shoving them in. So that's why the hairline never really looked natural. It looked too straight across. Because if you look, your hair never just goes straight across. It kind
Right.
of does this little zigzag. So if you transplant the units, you're not getting these straight, unnatural lines. You're getting the natural variation that you do with hair. So it's actually brilliant, and it looks great, but it's a lot of work. It's very tedious. Um, Uncomfortable because obviously you do have to get a lot of pokes and things like that when they're doing them, and it's a longer recovery because it kind of takes a while to look good, and then you have to go in and do it again. So it's probably a year process when you really are done.
Well, that's quite an investment, but I mean, as long as, I guess, at the end of the day, you're getting
Yeah,
what
yeah.
you're signing up for, right?
No, as I said, the concern would be when you transplant them, would they then just be under the same signals that the old hair was and fall right out?
Right.
But they actually maintain their origin, which is very interesting.
Yeah, it is actually, because you'd figure that would
Hmm.
be a more systemic thing, but I guess not.
Yeah, no, no, I guess they bring that with them.
Hmm. And the hair that grows, I mean, again, the other criticism of the old hair plugs and even hair transplants that I've heard is that it doesn't quite look the same. It kind of looks maybe not quite as thick, not quite as long, kind of more looks like peach fuzz, but that's not the case, right? I mean, if
No,
it
no, no,
takes it
definitely,
real, it's the
definitely.
real deal.
It's the real deal. Again, the issue is how much hair loss you've had.
Hmm.
If you've lost a little bit of hair, that's easy. If you've lost a lot, it's going to take a long time and money. So if you're planning to do one session, it's probably not even worth it because that would look weird if you have like few clumps of hair. So you really want to say, you know what, I don't have the money or I do have the money. And if you're starting the process, you have to know it's going to be a year. And if you have the money to invest, I think it's going to look good. It's just some people start and they're like, well, I can only afford 2 sessions and that's all you
Right.
get.
Right,
So yeah,
which doesn't is not great. Now, the
no.
other thing I saw was scalp micropigmentation. So this is not the spray on hair that I saw in the
No,
infomercials
no.
of the
So
90s,
so
right?
this is, if you think about it, is essentially tattooing, permanent makeup tattooing. So if you know how women get their eyebrows done, and do the permanent eyeliner, so we call it microblading. So it's a
Hmm.
little different, than just drawing a line of the eyebrow. They actually, they make them look like little hairs, so to speak.
Hmm.
But essentially, again, if you're completely bald, it's going to look ridiculous. But if you're kind of thinning where you can see the white of the scalp and you go in and you tattoo the dark little lines, the eye can't tell if that's scalp or hair because it's dark, it blends in, and it looks pretty good. Again, if you're not bald and the hair is just thinning,
Right.
so
So
you can have
this is
that.
supposed to kind of fill in the blanks, not
Yes.
replace a full head of hair,
Yeah, and
basically.
I've actually we do this again. A lot of women do it for eyebrows. So I've seen it for a lot of eyebrows, but we have a lot of women who have different issues for hair loss. And so we've actually we have some microblading artists that we refer to. And again, it takes a few sessions, but it looks and it's cheaper, much cheaper than the hair transplant. So that's the benefit. And it probably does have to be touched up every 3 to 5 years because it does fade. But it looks very good. I mean, for the women that are, self-conscious, and I think the same for men, if you've just lost a little bit in the temples here and, it's just not full, I think that's a very nice option.
So with the hair transplants, obviously, there's clinics, hair transplant surgeons that do it. Who does this micropigmentation? Is it also the same type, or is it just actually estheticians that do it?
Estheticians, yeah, they're usually estheticians, and I don't know if they have a special license to do the permanent makeup or the microblading, but they're essentially estheticians, and this is done like a tattoo, essentially. It's a little more superficial than they do the tattoo pigment, from what I understand, because obviously it doesn't last as long as a tattoo would, but it's still semi-permanent.
So both with to that point, as opposed to even medications or supplements, these last two options of the hair transplant and the micropigmentation are invasive to some extent, and they can be permanent. And that being said, I mean, with your experience as a dermatologist, neither a hair transplant nor micropigmentation requires a prescription, a referral. People they market to people directly. I guess the question is, should a guy off the street who is worried about hair loss and says, "I want this," should they consult with the dermatologist before going that route just to get an
Well,
opinion?
I would, because, obviously, if you're going to go to a hair transplant surgeon, he's going to want to do a hair transplant, and again, it may be wise to maybe start something beforehand to thicken up the hair. Maybe you'll still need a transplant, but maybe it'll be much less extensive, and maybe you would need fewer sessions if we can get the hair thicker in a year.
Right. And also, I just wonder, as a layperson walking off the street, you really have very little insight as to what this is going to look like, or if it's even right for you. you know?
Yeah, no, and that's why I tell people, number one, that number two, you want to make sure it's right for you. You want to make sure that that's the type of hair loss that you have. A lot of times, it's deceiving. You may think someone has male pattern baldness, and I end up doing more biopsies than you would think, because sometimes it is the autoimmune hair loss, or sometimes it is stress related, and it mimics this. In which case, you tell them, we can work on it, and there's different treatments, and some of these things will resolve on their own, and this would all be for nothing. So a lot of times it's good to see and confirm that it is what you're thinking it is, and are there other treatments. And then two, you also want to get a good recommendation. It's like a plastic surgeon. Anyone can set up shop, but you want someone who's had a lot of experience doing only hair transplant, not someone who like does it once in a while. You want to make sure it's a board certified dermatologist who's had experience with the latest techniques, because I'm guessing some people are still doing the old, block sections, and they may be less expensive, but it's if you're going to invest, then you might as well go to the best.
I think that's such a good point. I mean, you really can't assume that any place you walk in with a shingle is going to give you the best possible care,
Exactly.
particularly when you're making such a huge investment and something that's so important to you.
Yeah.
And it is dermatologists that do the hair transplant surgeon. Are they generally dermatologists, or are they
Yes.
general surgeons? Or I mean,
I think for the most part, they're dermatologists. Anyone could do hair transplants, but the training is usually during dermatology residency. So I'm guessing most of them are dermatologists.
right. You don't want to go into something like this for somebody who's doing this as a hobby.
No, it's actually very precise. The hair follicles are separated like under the microscope. This is actually like much more high tech than I've described it. There's a lot more, science involved. So you really want to go to somebody who knows how to look at hair follicles and how to divide them so it looks natural.
Yeah, that makes a lot of sense. Now, one last thing. So this is just fascinates me beyond belief. I've seen a lot of commercials for, speaking of hats, right? I've seen a lot of commercials for these LED light therapy. I think one of them is called Capillus, I guess the play on the cap, or maybe capillary,
Yes.
and Revian, where basically, again, the commercials I've seen, it's literally like a baseball hat that you wear while watching Netflix, and it has these light emitting diodes, this LED lights that are supposed to, you take it off and all of a sudden you've got a full head of hair.
Yeah.
Can you shed some light on, no pun intended, on these
Yes.
LED hats?
So yeah, the LEDs, they're basically, and before they were these LLTs, which were essentially low level laser light therapy. Now they use these LEDs, which are red or near infrared light.
Mhm.
And again, we think that they maybe increase the circulation. I don't think they have any effects on the hormones or the testosterone. And there's really no controlled studies. So it's one of those things that if you read the literature, says, yeah, there's some increased hair density after 6 months. But if I was serious about treating my hair loss, I would probably invest in one of the more tried and respected treatments, unless I do this as an adjunct. So this
Right.
would be something that, if I had someone who was already on the finasteride and using the minoxidil, and he's like, hey, do you think I should get this comb or this hat? I would say, sure, it's harmless. You might as well get the hat. But if he's like, I'm going to invest in this versus using the minoxidil, I would say no, because the data for basically the best studied things are going to be the finasteride and the minoxidil, and obviously the hair transplant if you're going that route. These other things probably have some modest effect, but would not be my only sole treatment.
Got it. And if you were to use this really is, again, this is not the person, the guy that needs a hair transplant. This is a guy who maybe has some thinning hair, and
Exactly.
same, it's the same camp as the shampoos, the minoxidil, the finasteride,
Yes,
etc. And
exactly.
if I'm not mistaken, these are not FDA approved devices, to my knowledge, as of yet, or are they?
One of them, I believe it was I think the low level laser light therapy, I think did at one point get FDA approval.
Mhm.
But again, to get FDA approval is, you have to really do no harm. And the efficacy it could be very little efficacy. Is the main thing is that it didn't probably show any damage, which I tell people. But the efficacy is less than compared with some of the other things we discussed.
Got it. Got it. Dr. Kandel, thank you so much for providing all of these insights for us. I think you provided a wealth of information to the average man who is a little worried every time he looks in the mirror and hoping to kind of, not lose the remainder of their hair or maybe grow some back. It's been a pleasure speaking with you.
Thank you.
Um, Thank you. And everyone, thank you for joining Better Man Clinic's podcast. And we remind you that your best self is a journey and not a destination. Treat every day as an opportunity to get that much better. Thank you, and we'll see you next time.